as a chief medical officer, how are you going to exercise that leadership? Is you're going to learn how to run a good meeting, because that's essentially how you function. You function in meetings. And the difference between a good meeting and a bad meeting is like night and day. Mm-hmm. So when you start out as a chief medical officer, your meetings are going to be terrible and you're going to suck at it. Okay? You need to realize it.
Hello and welcome to the Fire Chief Podcast, the only podcast dedicated to the Chief Medical Officer. I'm your host, Lee Scheinbart, and this podcast features stories and wisdom from the best CMOs in healthcare. Today, our guest is Dr. Eric Bricker, Chief Medical Officer, A Healthcare Z, and who otherwise needs no introduction to most of our listeners. So, Eric, let's get to it. Welcome to the show.
Hey, Dr. Scheinbart, thank you so much for having me. I don't know if I'm one of the best CMOs. I'm a CMO. I'll give you that much.
That's good enough for this show. That's the litmus, and that's good enough. And you please call me Lee. And you know, we do have a couple of things in common before we get too far. First, we're both products of Big Ten schools education back when it was truly only a 10-team conference, right? So are you an NCAA sports fan?
Yes.
Of what? Basketball, football, something else?
Oh, both basketball and football. Yes.
And you went to University of Illinois, right? Do I have that right?
Yeah, U of I for medical school, correct.
And you earned your undergraduate at Northwestern, right? Do I have that right?
Yes.
All right. The other thing we have in common is we're both authors of books, and yours is called Healthcare Money Campfire Stories. And we're going to get to that in a few minutes. But last of all, it feels like we've both found a place as educators relative to healthcare. And that's the piece that is most fascinating to me and why I invited you on the show, among many other reasons, particularly as you've chosen many short instructional videos to deliver your observations and thoughts about healthcare. How many videos do you think you've created?
Oh, unfortunately, it's almost 500. It's an odd hobby, but yes, I make healthcare finance educational videos on a channel called A Healthcare Z on YouTube and on LinkedIn. And yes, I've probably made too many of them.
Well, so let's start a little bit at the beginning here. And please tell our listeners where you grew up and what was going through your mind when choosing.
So I grew up in the suburbs of Washington, D.C., and I have I've got a non-medical family. I come from a long line of farmers and accountants and engineers. So I was fortunate, though, because the town next door to where I grew up is Bethesda, Maryland, which just happens to be where the National Institutes of Health are located. And we had a family friend at church who was a scientist there. And she came up to my dad and she said, "Hey, we've got a summer internship program, and I know your son Eric likes science. Would he like to have an internship at the NIH for the summer?" And I was 16, and I was mowing lawns, and it was paying $9 an hour. And this was in 1992. And $9 an hour in 1992 is a lot of money. And I'm like, it's in the air conditioning and it pays $9 an hour. I don't care what I'm doing.
That's about like $27 today for inflation.
I mean, it's unreal. I could not believe it. And so it's close to my house. I mean, people come from all over America to get these internships. Yeah. And it's like literally 10 minutes away from my house. And so, and that's where I got my start. And it was just, fascinating. And it was really interesting. I worked in an all-female lab. So it was like, science and medicine, so like male dominated. The head of the lab was Dr. E. Joan Blanchett Mackey, this tough lady from Queens. And I was the only guy. All the other scientists were ladies too. So I was the oddball in the lab, being a dude. But it was kind of isolating, and I really liked people. And so Dr. Mackey said, "Well, if you really like people, you like science, then maybe you should think about being a doctor." I was like 16, like I don't know what I'm doing. That's a good idea. So let me look into that. And so I volunteered in an ER the next summer, just wheeling people down to radiology and, holding stuff back in the suture room and all that sort of stuff. And that's, thought it was just fascinating, super interesting. And then was, pre-med, undergrad at Northwestern, but I was an economics major because the TV show ER was very popular at the time.
Yes.
And so everybody wanted to be a doctor. So it was super hard to get into medical school. And like the people at Northwestern was like, there's like a pretty good chance you're not going to get into medical school. So you better have another plan. And so I was an economics major because I'm like, well, I got to have a backup plan to get a job. And this was also when it was the late '90s when I graduated. It was '98, and obviously pre-med. I spent time. I just like lived in the library as an undergraduate. I was constantly at the library, and I was like, enough of this. And they were just giving away jobs in 1998, right? It was the internet boom. Like you could not get a job. Like if you had a post, you got a job.
Right.
And so I got a job as a hospital revenue cycle consultant. And I had no idea what that was. I'm like, whatever, you know?
Wow.
And I only did like one interview, and this is the only job I interviewed for. And it turned out that this company called Stockamp and Associates was the premier revenue cycle consulting firm for the major academic medical centers in America.
Wow.
So the entire billing and collection process for New York Presbyterian, for the Cleveland Clinic, for the entire University of California system, for Stanford, Vanderbilt, Northwestern, Rush, you name it, Stockamp designed that billing and collection practice. And so I got front row seat to the debacle that is healthcare billing. And I'm like, this is fascinatingly horrible. So
Okay.
I'm like, okay. And so when I'm like, okay, I still want to be a doctor. So I went to University of Illinois for medical school, but I'm like, I'd love a way to combine sort of being a doctor with helping to fix the sort of financial mess that I was seeing right around the year 2000. And then because I was from Maryland, I had an opportunity to do my residency at Hopkins. I'm like, okay, I'll be an academic physician and I'll be a policy wonk. Because Hopkins does a ton of Medicare is located in Baltimore and they do a whole bunch of policy stuff.
Right.
And I'm like, I'll just be like a healthcare services researcher, academic physician. And then when I got to Hopkins, I realized that just research was just too slow for me. And I just I was too impatient. I didn't have the patience for publishing papers. And I published like 1 or 2 papers in residency, but it just like, oh, this is painful. It's important. Don't get me wrong. People do research, publish papers, super, super important. Just wasn't for me.
Right.
And so that's when I formed a company with one of my consulting colleagues that was what's called a healthcare navigation firm. And I actually started that business while I was in residency, and my business partners were in Dallas. So after I finished my residency, I moved down to Dallas to start that business. So anyway,
how long were you
more long-winded than you wanted.
No. That's perfect. And how long were you in that newly formed business? Approximately.
Yeah, so that company is called Compass Professional Health Services, and we founded the company in 2005, and we sold the business in 2018. So it's 13 years total.
Gotcha.
And that's where I was. That's where I was the quote unquote founder and chief medical officer.
Gotcha.
And so we basically did the outpatient care coordination for people, but we were hired by their employer. So if you were a McDonald's or a T-Mobile or a Chili's restaurant employee, like all that stuff that primary care physicians are supposed to do in regards to like care coordination, and like it never gets done. And so we didn't do any of the actual clinical decision making, but as far as like finding you a doc, getting you an appointment, making sure your insurance covered it, making sure the prior authorization went through. If you had a bill, we would fix your problem bill. So we took care of all of that morass.
Right.
And that was especially important then because that was right when health savings accounts were coming out.
Right.
And so the co-pays were going away and the deductibles were going from $200 to $2,000. And so all of a sudden, all the employees and their family members were like, I've got this huge financial responsibility. My company's insurance is terrible. And the company was like, well, we're going to hire Compass and this navigation service. And we had like hundreds of employees that were on the phone and chatting on email and text and navigating the U.S. healthcare system. And we had about 2,000 employer clients. It was about 1.8 million people that we helped navigate the U.S. healthcare system for 13 years. So you learn a thing or two when you do that.
So we're going to come back to that, and hopefully you'll help me remember this. So we're gonna back up just a little bit. So the timing of this is quite remarkable to me because the era of the VHS and Betamax began in the 80s. As you're going through this experience in the lab, you're being turned on to go into medicine. You go to medicine. The pace, as you describe it, between publishing and research versus just getting in there and doing things and fixing things that appear messy, and it's more than just appearance, it is messy. It certainly aligns very well with your background. Now, it must have been a dream at some point when somebody produced YouTube, because you could go from a VHS handheld camcorder like thing all the way to digital performance. So why don't you take us from that role at Compass to how you evolved into A Healthcare Z and the preparation of these videos? I really want to hear about what was going on in your world at that time.
Yeah, thank you for asking that. So when we sold the business in 2018, myself and the CEO left as a result of that. So we sold to a much larger company with like 10,000 employees. Or like, our leadership's going to take over now, so we left. And I was in a unique position in that I wasn't beholden to anybody. I was sort of a free agent, right? So I wasn't working for the hospital system. I wasn't working for an insurance company. I had no boss. And so I had seen so much around the inner workings of healthcare and health insurance that I'm like, there's very few people in America that can actually kind of like shoot people straight and not be worried about losing their job. And so I'm like, YouTubers. So and I started making these videos in 2018. So YouTubers were like alive and well in 2018. And so I'm like, okay, well, I'll just make these videos on YouTube. And one of my favorite quotes is from Linus Pauling. I'm sure your viewers know who that is, right? He won the Nobel Prize in chemistry.
I would hope so, because they did earn a medical degree. And at some point, you have to study biochemistry.
So, I mean, Linus Pauling is the man. And anyway, one of Linus Pauling's famous quotes is, in order to have a good idea, you have to have a lot of ideas.
Yeah.
And so in order to have a good video, you have to have a lot of videos. And so I'm just like, I need something just super quick. So I'm just going to do a whiteboard and like, just do it in my my spare bedroom. And I'm just going to get it up there and just do, it's going to be like ants. It's not going to be like, it's not going to be like, it's going to be quantity over quality.
Yeah, and quantity has its own quality, in case you've never heard that one.
And so, but when you do that, you get tons of iteration so that you get a lot better, right? Yeah. And also, too, healthcare is so complicated that, like, anytime you try to talk about healthcare at length, like, it is so boring, right? And so I'm just like, keep it short, like, 5 to 10 minutes. Here's just one little vignette about, how something works. And let me just, hit you hard, hit you fast, and be done. And, at first it was like 5 viewers, then 50 viewers, then 500 viewers, and it's just grown from there.
Yeah. I mean, we're still at like 2 viewers, you and me, and no, just kidding. We're growing too. So, and we appreciate all of the help we can get. Now, what is fascinating again is your accelerated pace of managing information, delivering information, and yet you wrote a book. So I want to hear about health, care, money, campfire stories, and how that fit into your thinking about putting material out there for the world to digest.
At the time, my sons were doing scouting, and we were, go on campouts, and I'm like, you know what? Like, telling stories around a campfire, it's actually a lot of fun. And, my boys were like, this is so cool. It's so different.
Right.
And so I'm like, that's kind of like
for thousands of years we've been doing this, but suddenly this is so different.
Oh, it's crazy experience. And so I'm like, and I had just finished selling Compass. And so I wanted to take what I had experienced in pre-med and medical school and Compass and capture that in sort of 16 stories. And really sort of the theme of my career has been around the influence of finances in care, in medical care. And so all those 16 stories revolve around the role of money in medical care and how that played a role in my pre-medical life, medical school residency, and then starting Compass.
Got it. Well, I appreciate that. And I think it's a great thing that you've put some of these stories down, that they can still have a place and live as people observe and understand what you just mentioned, which leads to yet one more question, right? So, do you believe in the phrasing, or both? So it's A, B, or either or both. The corporatization of medicine or the financialization of medicine, or both?
Yeah, it's both, and really the corporatization is an effective mechanism for maximizing the financialization.
That's a great answer. That's going to have to be borrowed for sure. So at all these different levels and all these different medium and opportunities to do what you do, What keeps you motivated to keep doing this day in and day out and engage professionally in front of the camera and continue to prepare material? Is it now habit? Is it something that you are still very jazzed up about? What motivates you to keep doing all of this?
Yeah, I'll just say that selfishly, it's a lot of fun. It's I don't know, like I said, it's like a hobby. Like I enjoy doing it the way people enjoy, like, I don't know, like skiing, right?
Right,
It's something
right.
I just like doing it. And the 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 topics within healthcare are like almost endless. So like I hate to say it, but at almost 500 videos, I kind of feel like I'm just warming up. I mean,
Oh my
we
goodness.
still got a long ways to go. Sorry, everybody.
You
We got a
do.
long
You
ways to
do.
go.
Well, so this brings me back to the comment earlier. So in your work with Compass, you provided a structure to help the McDonald's employee, the Target employee, and help them navigate the complexity of getting and receiving both the healthcare and the financial layers involved, all of
Right.
that.
That's right.
And so anybody who pays attention to Dr. Bricker's videos will grasp exactly what he's talking about, which is bringing short informational content to you about how the system is structured, how it works, how you navigate it, what thought leaders are producing. And it's great for company leaders, for HR leaders, for benefits leaders, et cetera, et cetera. But here's a gap that I am observing. There is an illiteracy amongst most young physicians early in their practice. Now, somewhere along the way, you get the Mike Tyson, you get punched in the face, you have this plan. I'm going to be a doctor. You're a doctor. And a couple of years into it, you're like, I don't know anything anymore. And you get the proverbial punch. And then you start talking to other people and you quickly find ways to learn the things that you didn't learn. I wonder if you've given any thought to this observation that there is a lack of literacy amongst the caregivers. Now, mind you, one more comment before I turn it back over to you. Not everybody wants this, and not everybody wants to be a leader. Not everybody wants to know all there is to know, but there is a deficit, and that I think we might agree upon. So, your thoughts on the matter?
Yeah, and the many much of medical training occurs in the academic setting, and so it's really carried out by academics, where their primary interest is really around like the three-part goal of any academic medical center, which is the patient care and the research and the teaching. And even then, the teaching is around the teaching of the clinical care and the research. It's not enough. So at the least, I think that in residency, that the faculty within the residency program should probably tell the residents there's this thing called an RVU, and it exists because literally my entire residency now looks was the RVU ever brought up. If you're going to be a doctor, you better know what an RVU is.
Yeah,
So,
yeah.
I mean, there are some, to your point, there's just some, you don't have to teach them all the 500 videos that I've made, but there's some super basic stuff that, frankly, to a certain extent, it's kind of like educational malpractice. If I
Yeah.
can finish a residency and I've never heard of an RVU before.
Yeah, I think I love how you distilled it down to if you don't watch 499 videos, watch this one on the RVU, because this is the thing. So the RVU phenomenon is a structured tool about how money comes in and how money goes out, and we are not going to talk about it on the show any longer, but that is exactly the one thing that you're right. And there is no space and time right now in our educational process. And I hope that changes over time. You had mentioned the initial folks in early in your life who helped you get an awareness of medicine and research and how you went about your career. Any other major influential folks that you want to mention as part of your career path?
Yeah, I would say what everybody else says, and it's their parents, and I was very fortunate. I was raised in a Christian home where my parents taught me to put God first, and kind of everything else flows from it. And I have found that has been not only the source of my motivation, but the source of my perseverance. And it's like what? Why are we doing this? Like, why is any of us like doing any of this? If not, it is to like, we're all God's children and to help out our fellow brothers and sisters. And I was lucky in that I grew up in a household where like that was not a foreign concept to me. So like I've been exposed to that essentially since birth. And there's no way that I would be doing what I'm doing if it wasn't for that.
Um, we've had many guests on the show, and you're the first to pay honor to your parents. So my hat's off to you for that. Um, what's the hardest thing you faced as an executive, either at Compass or since that time? I have chief medical officer wannabes out there, and I know that it gets tough and rough, and it is not devoted to just the hospital environment. We have lots of CMOs from lots of broad backgrounds. So what's the hardest thing you've faced?
Yeah. Again, I think it's pretty common answer. It's really hard to fire people. It's also super necessary, right?
Yeah,
So everybody who's ever been a leader or a boss or run an organization, it's like if you're not firing somebody, like you're doing something wrong, right? Because there's no way that everybody is performing the way that they should.
Well,
if
you're in Lake Wobegon, everybody's above average. So
that's right. That's right. And Lake Wobegon does not exist. Okay. Right. And so you've got to get rid of the people, whether it's because they're incompetent or it's because they're unethical or it's because they have a toxic attitude. I mean, you've got to. Now, when you do it, it's super hard. Yeah. Like it's not pleasant at all. But it's just one of those things that, everybody says this is like, well, what do successful people do? They do the things that unsuccessful people aren't willing to do. And there's a lot of people in medicine and in healthcare that are frankly unwilling to fire people, and you just have to do it.
Yeah. No, well stated. Well stated. Are there any major dumpster fires that you've experienced in your professional career that you were called upon to manage?
Yeah. So this is where I think training as a physician, I think is super helpful. Like we have an edge because our training largely involves dealing with, so I'm an internist. Involves, dealing with patient care dumpster fires. And of course, you get a lot of that in the ICU and the CCU or the cardiac care unit. But you also get, I would call them acute floor decompensations. I call them AFDs. We're like, it's ladies over in the corner on, 237W West, and she's just hanging out. And then all of a sudden it's like, oh, crash. Can barely get a pulse or, her O2 sat's super low and she's breathing 45 times a minute or whatever, right? And it's like, oh, crap, what are you going to do? And I would walk into the hospital every day and I would say to myself, something terrible is going to happen today. And sure enough, almost every day, something terrible would happen.
This is what my wife calls the inappropriate laughter, right? Like people are sick and they are in trouble. But these things are so humbling. And you sometimes in medical life, you laugh at the most inappropriate things. And I will excuse and pardon both of us for doing it because nobody, unless you've actually done this as a nurse, a physician, respiratory therapist, somebody in the middle of the night as a clinician, you just don't understand what it is that we're talking about. So yeah, we are well trained and you must be listening to the show because I bring up the fact that physician executives absolutely have an edge. All of the things we go through in our training prepare us for dumpster fire after dumpster fire otherwise, I don't know, maybe you were a pathologist, so be it. But everybody else, yeah. Anyway, go on. Was there any particular fire?
So what that does is that it allows you to, because obviously in those situations, the number one thing you don't want to do is to panic, right? Because when you panic, then you can't think straight. And so you have to remain calm because we don't have to get into the physiology of it, right? But in order for us to use our frontal lobes, we have to not be emotional. Because as soon as you get emotional, you start using your midbrain instead of your frontal lobes, and then it all goes out the window, right? So you got to stay calm so you can continue to be rational of, okay, this person is actively seizing in front of me. I got to get an ABG on them. I got to do a finger stick for their glucose. We got to put, nasal cannula on them or a face mask to make sure that they're, saturating okay, blah, blah, blah. And so what that means is that when you're in the business environment of like firing somebody, or you're in a business environment of being fired by a customer,
right?
Or you're getting a bad performance review. I mean, there's all sorts of these. It's like, okay, like this is bad, right? We're losing a customer, whatever. Like someone is not literally dying, okay? And so you put it in perspective, and you're like, okay, well, I'm not going to get emotional about this situation because it's certainly not as intense as like someone being on the verge of death. And it's like, literally, if you don't do the right thing, like it's on you. Like literally the only thing that's standing between this person and death is literally what you are going to do. And I was like, and that was where residency was like, holy crap. Like, and I'll be honest with you. At Hopkins, we didn't have a lot of attending and senior resident support. Like you were on your own, especially between like 6 p.m. and 6 a.m. Ain't nobody going to come in and help you. You know, there were no fellows in the hospital. There were no attendings in the hospital. It was just you. Anyway, so you get battle hardened. Okay, so fine. So, but what that is, to specifically answer your question, is that, look, the dumpster fire in healthcare today is affordability. That is the dumpster fire. The unaffordability of healthcare is the dumpster fire because it impedes access. People can't get the care because it's too expensive. And if you don't have access, then that hurts the outcome. So literally, affordability is an outcomes issue. Affordability is a quality issue. Affordability is a safety issue. And so we can organize the deck chairs on the Titanic as much as we want, but the affordability Titanic is going down unless chief medical officers do something about it.
Well, that's a mic drop, sir, and that is exceptionally well stated. And I'm not at all surprised that you have a deep, deep insight into the real dumpster fires, and in particular that one. What did you do to develop your leadership skills along the way? How did you develop those tools and tactics to be a leader?
Yeah, so it's a great question. Because to be a chief medical officer, I think the number one trait that you need to have is humility. And just to be, listen, I'll be honest. The number one problem that I have, and that a lot of my fellow physicians have, is pride. Is I think I know everything. And listen, when you get into the chief medical officer role, you just need to understand that I'm going to use a bad word here. You don't know shit. Okay, and that what that means is that, okay, from a leadership perspective, you don't know what you're doing. So you better use what physicians are very good at is being autodidacts. We're very good at teaching ourselves. Okay. So no one's going to come along in some sort of golden chariot and teach you leadership. Like you need to teach yourself leadership, and you need to figure out how to do it. Okay. The person that I figured it out from was Stephen Covey and the 7 Habits of Highly Effective People and the 8th Habit. And as a leader, as a chief medical officer, how are you going to exercise that leadership? Is you're going to learn how to run a good meeting, because that's essentially how you function. You function in meetings. And the difference between a good meeting and a bad meeting is like night and day. Mm-hmm. So when you start out as a chief medical officer, your meetings are going to be terrible and you're going to suck at it. Okay. And you need to realize that, you are below an intern, like cruddy meeting runner. And you need to fight like mad to have really good meetings. And how do you judge a good meeting? The meeting translates into specific actions that specific people are going to take by a specific deadline. The whole point of a meeting is to translate into action. And so you measure the success of a meeting by the action that comes out of it. And if you don't have action out of that meeting, then your meeting sucked.
These are skills that you do acquire after medical school and after your training, and you do have to do it yourself. I agree. So happy to hear your insight on that. If a physician today were thinking about exploring a career and pivoting towards either some management role, leadership, entrepreneurship, with the intention of garnering and earning the title of chief medical officer, are there any pieces of advice that you might share beyond what you've already said about starting down that road to becoming a titled medical leader in an organization?
Yeah. So great question. So one, you've got to have the humility to recognize that there are some absolute deficits and skills that you don't have, right? So one of those is going to be, leadership and, learn how to run a meeting. Okay. Another one is you're going to need to be able to sell. Okay. Even if you're not in a quote unquote sales role, you're going to need to, by sell, what I mean is persuade. Okay. You're going to need to learn how to persuade people. Okay. And probably the best book that I've ever read on persuasion is How to Win Friends and Influence People. Okay. And so you absolutely, it's a skill that can be learned. It's like playing tennis. Okay.
Mm-hmm.
It's a skill that can be learned. And there's certain approaches that you need to have in regards to like, okay, if you're going to persuade somebody, then the first thing that you're going to do is you're going to ask them what they think about it. And you're going to listen to them because they need the emotional space to get off their chest, their viewpoint about a particular thing, so that you can not only understand where they're coming from, but that so that they can feel understood, right? So typically, doctors might have that type of relationship with a patient, but a lot of doctors don't have that relationship with nurses, right? They're like, I don't really give a darn what, nurse, what you feel about this.
Mm-hmm.
Like, I'm going to tell you what to do and you're going to do it.
Mm-hmm.
And guess what? As a chief medical officer, that will fail over and over again. So you cannot do that. So you got to be able to sell. You got to be able to persuade. Okay. You have to at a very basic level, you have to know how to use Excel. I mean, if you're a chief medical officer and you don't know how to use Excel, you are hosed. Okay. So like it's, again, if I have to tell you how to learn how to use Excel, we got bigger problems, right? You need to be able to figure out how to learn how to use Excel, because one of the things that chief medical officers have to do, we have to budget. You have to learn how to create a budget, and you can't create a budget without Excel. So there's, again, medical school, residency, fellowship, like, you don't know, you have zero budgeting skills, zero. Okay. And like, you need to know how to budget. Okay. So you got to learn that. Okay. Last one, I'll tell you, you need to know how to project manage. Okay. Managing a project, again, is a skill. Okay. And there is a specific tool you can use for project management that's called a Gantt chart, Gantt, that lists out the things that need to be done, who's going to do those things, and then the dates that those things are done by. And then it lists it out. I think of it like putting on the Olympics. Can you imagine putting on the Olympics? That's super complicated, right? You got all the different events. You got all the venues you got to build. You got to bring in all of the competitors. You got to bring in the judges. You got the spectators, right? That is a huge project that requires incredible skill to organize that project. As a physician, you don't know how to do that. You have no clue, and you better learn.
Yeah.
Okay.
Yeah,
as a chief medical officer, you better learn how to project manage.
I'm getting PTSD just thinking about all the things I did learn to get to where I got, and what got you here won't get you there is another great saying. So, yeah, very helpful. Do you know why we call this podcast The Fire Chief, by the way?
No.
Wow. Well, because being a chief medical officer is no small task, and it takes intentional preparation, although a lot of it feels like a trial by fire. My old boss told me that this whole experience is like a career in firefighting. You go to firefighting school, you train, you drill, you're ready to fight a fire, you put on the uniform, and you go out as a fireman, just like a medical student and a resident and an attending. And then one day, somebody calls upon you and says, hey, you might be a great squad leader or captain, or maybe become the fire chief of the firehouse, And my boss always told me, you're never going to be a good fire chief without first becoming a great firefighter. So that's why we call it that. Do you agree with that?
100%. Yeah. And you know what? Because honestly, being in charge of anything is really being a firefighter.
Yeah.
It's like, guess what? Welcome to leadership. It's a horrible job. Okay.
Okay. Now don't dissuade our audience. And it's very fulfilling, but you're going to be wearing that firefighter uniform. That is for darn sure. And maybe one day you get to be the fire marshal. Like if you're really good at it, like then you oversee lots of fire chiefs and you're in.
That's right.
So anyway, it's been a pleasure to have you on the show. I appreciate all your insights. Any last words that you want to add?
No, Lee, thank you so much for having me on, and thank you to all your listeners for tuning in.
Oh, thank you again. You have been listening to the Fire Chief Podcast, the only podcast dedicated to the Chief Medical Officer. Want to learn more about what it is like to be a CMO? If you want to be on the show, email me at leescheinbart@gmail.com or connect with me on LinkedIn. You can listen to the podcast on Apple, and you can also watch the videos of the shows on YouTube. The show's website is thefirechief.podbean.com. I love talking with CMOs from all walks of life, from all over the United States. So please connect with me, leave your reviews and your comments, and please share this with your colleagues. And in the words of Sergeant Phil Esterhaus, let's be careful out there.